Hi, it's Michael here from Bayside Headache Clinic again. Today I want to talk about why people get headaches and migraines. And I think the best piece of advice I can give you today is stop banging your head on walls. So today I'll be talking about causes of headaches versus the triggers, the two headache pathways and why they exist, the greater occipital nerve, where it comes from and why it's relevant to you, the sub-occipital muscles and how important they are for balance and proprioception. Why do you get associated features like dizziness, nausea and light sensitivity? And how I can help you to overcome your problems. So let's get started. The first thing I want to discuss is the triggers versus the causes of headache. So when I ask people why they get headaches or migraines, the vast majority of them will tell me about what triggers their pain. These vary a great deal, but some of the more common ones are things like red wine, stress, lack of sleep, bright lights, fluorescent lights especially, changes in hormones, and there's many, many more. And I understand that this is what triggers their pain. This is what pushes them over the edge and gives them a headache. But it isn't the underlying cause of their headache or migraine. And the simple answer is no. Research in the last 20 years has shown that headaches and migraines come from the brainstem. So the brainstem is located at the base of the brain and it extends down into the upper part of your neck. And it gets lots of input from the nerves of the head, the neck and the facial area. So people who have frequent headaches and migraines have been shown by recent research to have a sensitised and overstimulated brainstem. And it's that overstimulation and sensitisation that's priming that brainstem to give them a headache. We suspect that it could be information from an outside source that's been constantly fed into the area of the brainstem that's responsible for headaches and migraines that's making it sensitised and overstimulated. Common headache medications like your triptans work by desensitising the brainstem and making it therefore less likely to give you a headache or migraine. So why is it the brainstem that's responsible for headaches and migraines? And the reason is that the brainstem gets information from the two nerve groups that tell you to stop banging your head on walls. So there are actually two headache pathways. Both of them exist to tell you to stop banging your head on things. There are other reasons why you can get a headache. Things like heat exhaustion to get you to rest and cool down, or dehydration to get you to drink more water. But the main reason that the pathway exists is to tell you to stop banging your head on things. The first pathway is via the trigeminal nerve. And the trigeminal nerve gathers information from the head, the face, the jaw, the teeth, the sinuses and the skull. As you can see from this picture, it has several branches that cover the entire front of the head. This information travels along the trigeminal nerve and ends up in the brainstem for processing. This picture shows the area of skin supplied by the trigeminal nerve. So it's the areas in green, blue and the pink. If you bang the front of your head on something, information is sent in via the trigeminal nerve to the brainstem. This information is then processed by the brainstem and it decides to give you a headache to tell you to stop banging your head and to make sure that you don't do it again. It sends this message out via the trigeminal nerve to the area where you banged your head and you end up with a headache. The other pathway that exists is at the back of the head, and it's the area in blue on this picture showing on your screen right now. The information travels into a very different path to what the trigeminal nerve does. So this area is supplied by the greater occipital nerve and a couple of its sub-branches. The greater occipital nerve travels from the head and down into the brainstem via the upper three levels of the neck. So if you bang the back of your head on something, then a similar thing happens to when you bang the front of your head. Information is sent into your brainstem from the occipital nerve via the upper neck. This information is processed and you get a headache to tell you that you did something stupid and not to do it again. If you're watching this video, then I assume you have headaches or migraines or you know somebody who does. So you may have heard or looked into getting an occipital nerve block. In the occipital nerve block, it's these nerves at the back of the head that are injected with a combination of steroid and anaesthetic to try and reduce the information coming from them and into the brainstem. And that hopefully allows it to settle down and reduce the pain of your headaches and migraines. And it's also the pathway that's most interesting to me, because it explains why the neck can be a factor in headaches and migraines. Information coming in via the greater occipital nerve feeds into the upper three levels of the neck. But other information from the upper three levels of your neck also feeds through the same pathway and into the area of your brainstem that we know is responsible for headaches and migraines. One of the other main sources of information comes from your sub-occipital muscles. So this is a picture of your sub-occipital muscles here, and they're small muscles at the base of your skull and the top part of your neck. So these small muscles have more nerve fibres per square centimetre than any other muscles in the entire body. They're not very important for movements of the head because other muscles do that job, but they give the brainstem lots of other information along all those nerve fibres for other reasons. And we think one of their most important jobs is to give the brain information on balance and head position for throwing, catching and moving. This information is called proprioception. So let's recap. We know that headaches and migraines are due to a sensitised and overstimulated brainstem. We know that there are two pathways that are designed to generate headaches and migraines in response to banging your head, and that one of them runs from the back of the head into the neck. And we know that the other information from the neck also feeds into the brainstem via the same pathway, especially information from those suboccipital muscles that have so many nerve fibres and tell the brainstem about balance and head position. So wouldn't it make sense that if there's a problem in the upper three levels of the neck, especially if it was a problem with those suboccipital muscles, it could be causing the sensitisation of the brainstem by feeding information into it constantly and not giving it a chance to rest or calm down. And if there is an issue with those suboccipital muscles that are so important for balance and head position, that would explain the dizziness and nausea that often go with headaches and migraines. Other symptoms like light and sound sensitivity, vomiting, food triggers, sleep disturbances, word finding problems, and all the other symptoms that go with headaches and migraines are explained by the fact that all these functions have a control centre in the brainstem right next to the headache and migraine centre. At Bayside Headache Clinic, we assessed the upper three levels of your neck to see if they could be the main contributing factor in the sensitisation and overstimulation of your brainstem, making it primed to give you the headache and migraine pain that you get. We look for a common but very subtle dysfunction in the suboccipital muscles, and that it's that common and subtle dysfunction that's constantly feeding information into the brainstem and making it primed and set to give you a headache or migraine. We're then able to effectively treat this dysfunction, which allows the brainstem to calm down and return to its normal state, and eliminate or significantly reduce your headaches and migraines in the vast majority of cases. We're located in the Bayside area of Melbourne, and if you want to book an appointment or for more information on our services, call 0423 071 971 or check out our website at baysideheadache.com.au. Thank you.